it is true, COVID-19 came as a surprise to many of us, and particularly in the labor market. The result, it is a very uncomfortable kind of a situation where some of these people are. But in other areas like hospitality and tourism, I think it's a bit complicated for obvious reasons. The communication, I think it's not that what we wanted. Employers seem not to have engaged with their employees, and some of the employees were just notified by a notice put on a door saying, yes, from this day we stop, and no further explanation what will happen thereafter. You can imagine this type of employees are in a situation where they do not know what to do. Well, there were a lot of suggestions which were made in a tripartite setup, and there were also some areas of disagreement, as you can imagine. When you have three parties always in this area, they tend to agree and also disagree. And one of the outcome of that meeting was definitely that we should not expect or encourage employers really to retrench their employees as the first result. We agree that employers and the employees should engage each other and try to find a solution. The second one was to see whether there could be some kind of relief from different institutions, to be specific, from Social Security Commission and other state-owned enterprises as well as the private sector, to assist the situation in terms of making sure that the employees are not losing their income and the businesses remain sustainable thereafter. To other recommendations of saying the state should also look at price control, especially on the items which are needed at this particular time. The sanitizers and other items which are necessary to keep the place and people hygiene. So those are wider areas we covered. And we are happy that some of these points have been taken up by the committee responsible for managing this pandemic.
Okay.
To begin with, I think it's important to understand that the COVID-19 virus and the state of emergency do not terminate contracts of employment. The only way that a contract of employment is terminated is if the employer takes action to terminate or if the employee resigns. Right? So the ministry, as the ED said, we have encouraged employers not to take action to terminate, to dismiss their employees. Right? So the employees, even if they cannot come to work, they are still employees. They're still subject to a contract of employment. This is important both for the security of the employees, but also looking to the future. We have to plan now for an orderly way to resume business operations when it's possible. Now, I want to mention in that regard that we have a provision in the Labor Act for the retrenchment of employees. We do not think that retrenchment is a practical or desirable action to take at this point in time, because of all of the uncertainty, and also because employers definitely will need employees when they resume, we think it's more important, it would be desirable to look at that situation once operations are able to resume. The other thing that I want to say is the ministry, and I would say the principles of state policy, put a premium on social dialogue and negotiations. In all areas, to the extent possible, we believe that problems can be understood and resolved by discussion. We were very, very encouraged to learn that in some of the industries where critical services have been designated, the employers and the trade union have met. They've even entered into agreements on what should take place during this period. So, yes, we are challenged by situations that we've never faced before. But the principle of job security, the principle of, to the extent possible, maintaining income for employees, and negotiation and social dialogue, I think, is what is guiding all of us. Now, I just want to mention one thing in that regard that might get overlooked otherwise, which won't get overlooked, but we have workers who are the lowest paid and the most vulnerable. We don't believe that employers should consider asking these employees to reduce their wages, because these employees can barely make it as it is. That's one thing. Then there's the question of domestic workers. If domestic workers are sent home, there may be employers who believe that they shouldn't pay them. We are of the opinion that these are workers who are very important to the survival of families and will be important after the state of emergency. So we've been involved in discussions where one company or another is talking about how we have to do this type of activity in order to maintain our plant or in order to maintain our business services. But the maintenance and the sustenance of human beings is a very, very important part of this discussion. So some employers, and certainly all of the employers who are receiving salaries at this point, in my opinion, do not have a justification for sending workers home and just saying, okay, come back later, but paying them nothing. I don't think it's necessary. But even many employers have reserves. They also have access to loan facilities that their workers do not. So I think all of these things have to be taken into account. Businesses will not resume and prosper if the workers have somehow been crippled, their health has been diminished. They're not going to go out and say, fine, we'll look for new workers. These are very valuable people who will contribute to the recovery.
Trying times, and those who abandoned us. I think that's a very important consideration to take into, because I know when the situation comes to normal, everybody wants to look at the state to get this and that. We may come back and say, yes, where were you this time around when you were in these difficulties? So we have to look at this thing broader rather than an opportunity to dismiss employees or to deny employees their wages and rights. So.
And I want to make use of this opportunity as well to commend and appreciate our health professionals for the good work that they are doing, for detecting, treating, and caring for our COVID-19 patients.
The good news is that new technology is coming on stream. Those of you who are following news on COVID-19 would have realized that in the last week alone, a number of new reagents have been cleared within the US by the FDA and in Europe as well. Those technologies are becoming available to us, and we have already been able to source some of them and expect deliveries most probably by the end of April. This will enable NIP to decentralize the testing that we are doing for COVID-19. So far, our testing has been centralized to the central laboratory in Windhoek, for the reasons I've stated. But once we start receiving these reagents that I've referred to, we'll be able to decentralize the testing to some of the major centers, most probably at the beginning to Oshakati, which is our second biggest laboratory, and then to the coast, and then as the outbreak develops, we will definitely be able to decentralize testing to any number of districts in the country, which will make it possible for us to test cases as they come up without having to transport the samples from the various collection sites to Windhoek. So that is good news. And also to say, because we have the machinery we have, it's machines that can also be used to test COVID-19, provided we get the right reagents. So we have machines in virtually all the districts of the country already that can be used to test COVID-19. And once we have the reagents, and depending on how the disease is breaking out, we will be able to sequentially open up laboratories to test for COVID-19. Right now we are testing in Windhoek, and because of the numbers, we have been able to continue testing in the confines of Windhoek. But as the numbers grow and as the disease breaks out in different parts of the country, we will be ready to conduct these tests. I think I'll stop there for now, Deputy Minister.
I'm Dr. Gashitai. I'm a specialist physician. I'm serving on the case management committee. Just to mention one thing, we are following guiding from WHO. There's a clear case definition which is actually coming there. And like, as most of you know, for you to be tested we are at the moment focusing on those individuals who are coming from overseas, who are coming from countries which have actually been affected by COVID. So that's the first thing, especially if they develop symptoms, then they will be tested. And then secondly, we are also focusing on those individuals who have been in contact with individuals who came from overseas, who have been symptomatic or who develop symptoms. The typical symptoms of the cough, the shortness of breath, and obviously the fever. Those are the individuals where we are looking at that. And then on the other side, just like the case number 14, which has actually been mentioned, health professionals who have been in contact with a patient who is actually coming again from overseas, who then develop symptoms like the fever, the cough, and the shortness of breath. And obviously also some of them are developing muscle aches and body ache. There is clear symptoms which are actually in that line. So this is generally talk about that. This is now around about our second week, 14 days since we diagnosed the first cases. And what we have done so far is actually to really contain this condition. We are presenting with shortness of breath, with cough, and all sorts of throat irritations, which are actually directly related to the allergic conditions. And they're coming much more to the fore. Very often I'm also asked to go to the hospital and look at this person, whether he fulfills case definition. And what I've so far picked up with a lot of these patients who are coming in the hospital is they are presenting themselves with allergic conditions because of the good rainfalls which we had and the green environment which is there, which is obviously triggering the asthma symptoms. The other side is also that the change of weather is also making a lot of people to sneeze and to develop flu symptoms, which are almost the same as the COVID. And that's the reason why we are not testing everyone.
We have put measures in place. When it comes to children, we are saying, or when it comes to emergencies, we are looking at child abuse, child neglect, children living on the street, issues of domestic violence. We know now that more than ever, many families will live together in one space for 24 hours, for 21 days. And that alone will create a lot of anger, a lot of frustrations, a lot of agitations, and that can also cause abuse against women or abuse against men, and also against children. When you look at the families in a village setup, for example, you have all the nieces, nephews, the uncles, and everybody living in one space for 21 days, together for 24 hours. There's potential for a lot of abuse. There's potential for sexual abuse and rape cases. So we have now, in terms of response, we have our social workers on the ground are full-time on standby. There is a supervisor in each region who's supervising other social workers. We are working together with stakeholders. If a case of child abuse or domestic abuse or rape or a street child is spotted, we have numbers that we will share with the medias where you can call. In most regions, we are working with Lifeline, Childline, and when a case is reported, or the case is reported to the police, so they have the numbers of the social workers on call who will take up the case and manage the case further.
I thought that maybe, let me just start off with some background, just so that I can then build onto the portal. So we know that the proclamation number 9, as was published on the 28th of May, it gave, for the state of emergency, it gave a few regulations there. We know that there's an Annex B, which contains Part 1 and Part 2. There's also, very important, there is, the regulation has number 14, and that number 14 is, it talks about directives, and it says that the president may authorize a minister to issue directives for 2 purposes. There's 1 and 2. The first purpose is to either supplement or amplify the provisions of the measure, the regulation, and also to ensure that the objectives of the regulations are met. So that is basically the background where I am coming from. So we have Annex 1, we have Annex B, Part 1 and Part 2. Part 1 is the one that looks at essential services, and that one is very easy. All those essential services that are listed there are as per the labor law. The Labor Act actually lists all of those, ambulance services, etc., etc. And then there's Part B that's looking at now business services. What are those business services, providers of products and services that still need to be able to be maintained during the lockdown? Because remember that we are still going on, we are still eating, we are still moving from A to B, and what are those crucial services that have been identified? So the Ministry of Industrialization, as this minister that has then been designated, has been able to designate those companies that are considered essential or crucial. Right? And the reason why this function, of course, is with our ministry is because we are the custodians of the business operation, either internal or external trade. That falls within the mandate of our Ministry of Industrialization and Trade. And what we have done to actually actualize or operationalize this measure is to develop then a certificate that we issue to the businesses. Initially, from the Saturday when the measure was actually instituted, we were handing out interim paper certificates. But of course, we soon realized that we were all endangering our lives because these papers had to be given to people. We couldn't continue emailing them. And of course, it was posing a health challenge to us as well as to the public. Because remember, we are still working within the provisions of the lockdown. We're still working within the provisions of maintaining safety because this is a health issue that we're trying to resolve. So we came up with an online portal. It's called namessentialsservices.com.na. And when you go to this portal, you then sign up first. It gives you a token. You then go onto the portal and then you create your own profile and then register as a service provider, essential or crucial service provider. Maybe just to give you an update of where we are now, I think when I spoke to the colleagues, we have approved about 1,100 crucial business operators. We have rejected about 500, and we have still pending 1,300. All right. So these business operators, of course, you know that they are they are listed. It comes all the way from number 1, agriculture, fishing, electricity, gas, steam, air conditioning, water supply purification, construction, as it relates to the fight against COVID. So one of the things that when we reject the applications is that number 1, there are too many people working. It has to be skeletal staff that is working, that's number 1. And number 2, they have to be able to tell us how are they responding to the fight against COVID. And so when we reject them, they could either come back and say, I have now a fewer number of people that are working, or if we feel that they are not supporting the COVID initiative, we would then just reject them straight away. Of course, we have had teething problems. You can imagine that I think it's almost not miraculous, but Herculean that we're actually able to come up with a portal, an online portal to have this registration taking place. And of course, there are glitches, there are teething problems that come with it, but we are working around the clock to work on this portal.